Well, I think there are two very different things that scientists should probably do. One is to better understand the policy community, so interact with policymakers to understand what those policymakers want from science. What are their evidence needs? What are the sorts of questions that they're asking that can be addressed through scientific experiment? But what I would not advocate is that something that many other people do advocate is that scientists try and sell their primary research to the policy community. The idea of going knocking on a policymaker's door and sort of waving your scientific paper under their nose and saying, well, you better take notice of this because it's the best piece of research that's ever been done, is not the way that scientists should be acting. Scientists should be contributing to the evidence base in an organised way so that their primary research should be sufficiently good in order to be included in a synthesis of evidence that will then go on to the policy community. So it's a multi-step process. So get to know what the get to know what the policy community wants, and then produce the best evidence that you can to contribute to the evidence base. But don't go trying to sell your piece of research to a policymaker and saying it's the better research than anybody else has ever done. I think that's a mistake that we're almost being asked to make by many research councils, for example, who give advice on how to go and sell your research or make sure your research has direct impact on policy. I don't believe that's the case. I believe that it's much more important to have an impact on the evidence base rather than a direct impact on policy. Well, that's a really difficult question, because what scientific evidence tends to do, it can lead to really transformational change, but that's very rare. It's much more likely to nudge, I think, policy in particular directions rather than changing policy in any sort of revolutionary way. There are some good examples of evidence changing policy fundamentally within the health services, and that has happened because particular drugs or vaccines have been produced which can provide real benefits to patients and save lives, or for example, clot-busting drugs have a profound effect, are very effective at avoiding death due to heart attacks and strokes. So as soon as that evidence became available, there was a policy to roll out the use of clot-busting drugs throughout the National Health Service. And that has led to a very large decrease in the number of deaths due to heart disease. And that's the kind of revolutionary impact that can occur. We haven't got those kinds of examples in the environmental sector yet, and I'm not sure we would expect it in quite the same way, because we're not so focused on one species, of course, and the welfare of humans. But there are certainly plenty of examples where policy has been either supported, such as the policy to lime freshwater bodies, for example, to counteract acid rain, and the use of manipulation techniques in lakes to counteract algal blooms, for example. These are things that support already existing policy. And then there are the very rare occasions when systematic reviews of evidence, of course, show us that some of the things that we've been spending our money on for a long, long time have not been effective, and we should reverse that policy or stop using particular interventions. And an example of that is the use of in-stream devices to increase the populations of salmonid fish, salmon and trout, which of course are of high commercial value. And it seems quite clear that the introduction of these in-stream devices like weirs and dams don't in fact work in that way. And so there are quite a few examples of the way in which science changes policy. Sometimes it's an individual piece of science, but more often it's a realization of the evidence base through the evidence synthesis, through the synthesis of lots of different pieces of science.